Hi, this is Matt Abdel from the Mayo Clinic, and I'm pleased to share with you the results of our paper in JBJS looking at a large series of two-stage exchange arthroplasties for periprosthetic joint infection of the hip. Now, you may ask why we decided to look at this cohort of patients. In reality, two-stage exchange arthroplasty of the hip remains the mainstay of treatment for periprosthetic joint infection that's chronic. However, there has been recent enthusiasm for one-stage exchange arthroplasty, particularly in North America, after Europe has published their results, with emerging results in the US as well. As such, we looked at a cohort of over 330 two-stage exchange arthroplasties for periprosthetic joint infection of the hip. We were particularly interested in cumulative probability of both reinfection, that is, any reinfection, and any aseptic mechanical failure. In this larger cohort with longer term follow up, we found some remarkable results in two-stage exchange arthroplasties for periprosthetic joint infection of the hip. We found that the 10-year cumulative probability of reinfection was only 11%, and that the cumulative probability of any aseptic mechanical failure was only 3%, mostly related to dislocation. Now, you may ask why the results of our series are substantially better than other reported two-stage exchange arthroplasty cohorts. Foremost, all of these patients had this treatment as their first treatment for periprosthetic joint infection. In addition, we have better diagnostics, better debridements, and better antibiotics such as rifampin. And finally, from an aseptic mechanical failure rate, surgical techniques and implants have improved, including highly porous acetabulum components, in addition to the use of dual mobility constructs to mitigate the risk of dislocation. So as you can see in our large cohort of patients who underwent two-stage exchange arthroplasty for periprosthetic joint infection of the hip, of which I should note 70% were McPherson host B or C class, and these were all comers, we found a very low rate of reinfection and a very, very low rate of aseptic mechanical failures. I hope you enjoyed this brief synopsis, and I look forward to speaking with many of you in the near future. Thank you very much.